Welcome to Equinox's virtual wellness series. Today's topic is coping with COVID-19 and beyond. First, I'd like to introduce you to Dr. Robert Hertz, our medical director. Rob, thanks for joining us today. Also, Janet Furbeck. Janet is the assistant program manager for our personalized recovery-oriented services, also known as PROS. Thanks, Janet. Also, we have Dominic Vergeri, who is the Director of Youth Services here at Equinox. So thank you all for joining us. So let's start out. Dr. Hertz, the pandemic has affected all of us, some in obvious ways, some maybe less so, but anxiety and stress about our health, about that of our loved ones, our jobs, and our financial stability really has taken a toll on all of us.
Yeah, this is a time when it's an extremely difficult time, and heightened anxiety and fear and feeling vulnerable. So that's understandable that we would feel distressed. For some people who are dealing, for example, with sobriety, it can be a time when they might tend to relapse, and those people would need more support. They need maybe to call their sponsors. They need understanding from others. Also, other people with mental illness, if they have difficulty getting their medication, they might begin to develop symptoms. People certainly can begin to have nightmares. That's actually pretty normal at this point.
And I know, Dr. Hertz, when we talked earlier, you mentioned about when we were saying about social distancing. You made a great point. You said, we really should be saying not social distancing, but physical distancing, because right now we don't want to be social distance, meaning we need that connection.
Well, that's true, that a better term is physical distancing, and we know that a lot of us are really we're yearning a lot for the social connection, and social connectedness is one of the main factors for well-being. It affects our immune system if we're isolated. And so social connectedness is not only better for our mental health, but it's also better for our physical health. Some of our people are in programs called PROS, Personal Recovery Oriented Services, and they come to 500 Central Avenue 4 days a week, 4 or 5 days a week, and now they don't have that programming at all. So that's a huge change for them.
Janet, because you are the assistant manager of the PROS program, what are some of the things you're hearing from our clients, our participants, and what are some of the things you are doing since they can't be here? What are some of the things you're doing to help them have those connections?
I think that we've all kind of lost our normal ways here, whether you're used to getting up and going to work every day or getting up going to a day program, going to PROS. We've all kind of lost our structure. So what we're trying to do here is help people build their own structure for their day. And setting regular patterns throughout the week are important. So we encourage people, pick a day that you want to do your laundry, pick a day that you want to do a church service online, pick a day that you're going to reconnect with your friends. Try and have regular times for your meals, your breakfast, your lunch, your dinner. We offer groups online. I know a lot of the AA, NA meetings are held online. I've had people who have joined book clubs online and that are doing yoga via Zoom, and people are reaching out in different ways to try and make those connections safely, but they feel that connection with other people, and that's truly what we're looking for here.
How are these particular issues really affecting our children, our teens, our youth in general, and what can parents or caregivers really be looking for to help the youth at this time?
I think first and foremost, to touch on what Janet was saying, is routine. These kids are used to a routine. School's out. They don't have a routine anymore. They're turned upside down because of this pandemic. I know at home it's very hard to juggle time with your child, do work from home, keep them semi-active, and keeping them from climbing the walls. It's almost impossible for these parents, and it's a real problem for everybody. I think for parents right now is to really try to get them to do as much as they can in a day to keep them active and moving and engaged, so they're not just sitting and thinking, what do I do?
Now, for the parents, we say what the parents should look out for their kids. What can parents do for their own mental health?
First of all, parents, you're doing an amazing job out there. Let me just say, you have been thrown into this new world and you've risen to the occasion. And I know you're thinking, man, I might not be doing it right and others may be doing it better. But let me tell you, you are doing great. You're doing a great job. Give yourselves a pat on the back.
We have a lot of high school seniors or college seniors, which this has been a tough year for them because it's always a special year to celebrate their accomplishments. What are you seeing, and what are some of the things that you feel we can do?
I think they're feeling a little left out. I think they're feeling like, I did all this work and I came to this point and where's my accolades? But it's very hard right now with the pandemic. So I think whatever parents can do family-wise, whatever they can do community-wise, and a tip with the kids doing the work up to those accolades, I should say, refer to your school district. Call your school district. How much should a parent be sitting down with a kindergartner, first grader, second grader? They will tell you how much actual teaching time you should be spending throughout the day. You don't have to do it all at once. Do it in small segments. Give the kids a break, go back to it later on. That's very important to reach out to your school districts. But I think overall, it's been a very hard time for seniors graduating high school, seniors graduating college. There's even seniors that are graduating high school now are wondering, am I going away in the fall? And it's really thrown a curve into everything. So the more you can do to acknowledge the accomplishments that they've made, I think are the better.
Dr. Hertz, I know you talked about gratitude and different apps that can be used. Tell us a little bit more about that.
At this time, we hear a great deal about what's wrong in the world, and that can take its toll. But for pretty much all of us, we can find some things that really are right in our world. And it's important to stop and look and listen and notice those things. One way to do that is to have what's called a gratitude practice, which is really just to maybe think of 2 or 3 things each day, maybe before you go to bed at night. Write it down in a journal and think about it. Once you start that, you begin to see more and more and more things that you're grateful for. And everyone can find something every day, in fact, that they're grateful for. And as you do that, your sense of happiness and well-being and overall health will increase. And there's another app that I like. It's called Healthy Minds Program. And other apps, Calm and Headspace, are useful too.
And we've been talking a lot about youth and families, but what about some of our senior citizens, especially isolation? We've talked about a lot of different things, the gratitude practice, which they can do as well, trying to connect. Is there anything else that we can suggest to help some of our seniors that might be more isolated or alone, to help them get through this time?
I know one thing that has been really helpful is that if people take pictures and you make copies or you send those pictures to your loved ones, you send them to your grandparents, you send them to your aunts and uncles, you send them to people to remind them of the times that you shared together. When that person gets that piece of mail and opens it up and there's their grandchildren or there's their sister or their brother, it really warms their heart. They carry that around, they remember these times are going to come again, and it's something tangible that they can hold on to.
Also, I would say just taking the time to call an old friend or a family member, just to say that, just calling to see how you're doing and just checking in, and little things like that can make a big difference too.
Unfortunately, our domestic violence counselor was unable to join us today, but she wanted us to share, at this time with victims of domestic violence, especially with the stay-home order, where many times victims are isolated with their abuser. Also, many abusers are using COVID-19 as a tool to threaten the victim as well. For anybody out there that is being abused or dealing with domestic domestic violence, know that even if you have symptoms and are concerned that you won't be able to get services, we're here to reassure you that you can. If you're unable to call our hotline number, again, due to the situation you're in, please go to Equinox's Facebook, which is Equinox Albany, and send us a private message via Facebook, and we will make sure our domestic violence staff reach out and help you in any way that they can. Now, we talk about people reaching out for supports. When we talk about mental health, people always do, there's a stigma around mental health. And as we say, our well-being includes physical and mental health. But why is there such a stigma, or how can we join together in helping those that are viewing this today to help us break that stigma and get the word out that it's okay to ask for help? We all face anxiety, and even more compounded now with this pandemic.
I think people try to think of themselves as being different and separate than someone who's identified as being mentally ill. And with these circumstances, we've all felt this intense anxiety and distress. And that is somewhat close to how our patients, people with mentally ill, feel. Vulnerable, fragile at times, confused, uncertain. So we're having an opportunity to begin to experience what a day in their life is. Of course, for them it's more intense and more persistent. So it's an opportunity to walk in someone else's shoes. And I think stigma occurs when we think that we're very different, and really we're not that different. So I think that's important to realize that we're all more similar than different.
One of the things is also nutrition and exercise and sleep. We know that they all contribute to our overall well-being, physical and mental health. What are some of the tips you can offer regarding that?
Nutrition, exercise, and sleep, those really are the foundations of mental health and physical health. And it's important to think of those as first things first. Sometimes we tend to schedule all kinds of other busy things around, and we don't get to the first things, the most important things. So it's important to have a schedule. That's what I would say, is try to have a regular schedule for your sleep, go to bed at a certain time, wake up at a certain time, get in some exercise. Just getting outside too for a walk, now the weather's getting better, every little bit helps.
Janet?
I also think that trying to maintain a structure as much as possible is really important. So try to find yourself going to bed at the same time at night, getting up in the morning at the same time. Once you get up, get yourself into the shower, get dressed, do those structural things. Being able to control your day and the structure of your day absolutely helps.
Great, thanks Janet. Dominic, and how about you?
I think the most important thing for, say maybe an 8-9-year-old through late teens, don't let them get into a routine as what they were touching on of just sitting around, not doing anything. Give them a couple things to do a day. Give them a couple tasks. And I think overall, the parents just have to be patient. I think it'll get there, but we have to be patient.
This is a wonderful book that I just wanted to share with people. It's particularly written for teens, but it's also valuable for the teen and everyone. And it's important to be able to feel and learn how to feel self-compassion. So I recommend you try it. I think you'll find it very worthwhile.
What should we continue to watch for? What are some tips you can give to people? Because we are in this for the long haul, as we all have seen.
Try to make sure that they keep up with their daily routine. Don't bypass some of the stuff that they put in place or started to do. Let them continue to do that, but maybe then branch out and do some other things in their routine. I think that's important that they kind of stay on top of that and don't kind of slip to the side and just kind of lay back, and especially with teenagers, try to keep them focused.
Well, I think that it can be very useful to do some journaling and some note-taking during this time. It's really a historic time. And it'll be important to think about what you've learned and what the benefits are, and then carry those things forward as life skills that may end up being useful for a long, long time.
And just remember that every opportunity that we have is time sensitive. So what's important to you today, make sure that you tend to it. Love those that you love. Let people know that they're important. Do the things in life that you need to do. Don't think we have everything forever, because that window of opportunity closes sometimes when we least expect it. So really, look at all that you have in your life today. Be appreciative, grateful, and keep building on it.
But I'm also hoping that after all this is an opportunity for us as a community, knowing that look what we can do when we're all trying to help each other out. I just think we are stronger together, and I know that's a saying that's been used, but it's so true.
I would just like to say, don't be afraid to reach out. It's very important to reach out during this time. Equinox as an agency has tremendous amount of assets that can assist you in many different ways. And we're here for you. We're all in this together. And please do not isolate. Reach out if you feel anything. Doesn't matter what you're dealing with.
Well, thank you. I could not say that any better. I'd like to thank our experts, Dr. Robert Hertz, Janet Furbeck, and Dominic Ruggieri for joining us today. And also thank you for joining us. We hope that this has been very helpful to you. And on behalf of all of us at Equinox, be well and stay safe.